Hello, hello, and good morning. This is Dr. Yonnette with another episode of Baby Talk. It's Friday. Yay, yay, yay. I know you've been working hard all week and you're looking forward to being home with baby. You and mom and baby, or you and dad and baby. And it's such a precious time that you have been afforded to raise the next generation of successful children. So yesterday when we met, we started talking about anxiety and depression. And I want to talk some more about this topic. But before I begin, I want to talk about what's happening around in our world. Just recently, one of the well-known celebrities, ended up taking his life. And I am saying that mental health is so important, perhaps even more important to physical health, because when you have a physical ailment, it shows, and it's easy for people to reach out and help you. On the other hand, with mental health, you go through that private struggle, and people around you have to be so aware of your experiences and look for those signs, those symptoms, and know how to extend help to you. And so I want us to be very knowledgeable about this topic as we continue to raise our babies, our children, and give them the best opportunity for success. So let's talk about what the treatments are for anxiety and depression. And again, I'm sharing information from the CDC. So the first step in any treatment that deals with anxiety and depression is to talk with a healthcare provider, your child's primary care doctor or a mental health specialist, and get an evaluation on what's happening with your child. Even in the school settings, you have counselors who are available and they can help guide you and help guide your child so that he or she gets the care they need. Now, some of the signs and symptoms of anxiety or depression in children can be caused by other conditions, such as trauma. And then specific symptoms like having a hard time focusing could be a sign of attention deficit hyperactivity disorder. But it is important, very, very important, to get a careful evaluation of what your child is experiencing so that you can get the correct diagnosis and treatment. So you consult with a healthcare provider, and that provider will do your assessment. A mental health professional can determine what kind of therapy, what kind of plan would best fit your child and include your family. So you may end up having behavior therapy, which includes the child therapy, the family therapy, or a combination of both. And then in the school, it can include a treatment plan that a child uses throughout his or her school day. For very young children, though, parents should be involved in the treatment. It's very, very important. It's key to have parents involved in the treatment. Another option that you have is what we call the cognitive behavioral therapy. And this is one form of therapy that is used to treat anxiety or depression in older children. It helps the children change their negative thoughts into more positive thoughts and give them effective ways of thinking and leading to more effective behaviors. I think of a particular child that I work with, and the child gets into this mood at different times where he talks about everybody hating him, all these negative thoughts about nobody wanting him to be around, and he has no friends, and this place stinks, And so this is where the cognitive behavior therapy will come in and help a child like this. Behavior therapy for anxiety may involve helping the children cope and manage those symptoms, and then gradually exposing them to their fears so that they can see that bad things do not occur. Now, how do you manage symptoms? Through health. One of the ways you can manage these symptoms through health is by making sure that your child is that has depression or anxiety is getting the right treatment leading to a healthy lifestyle. In other words, you want your child to be able to have a great play opportunities, and you role play the managing of these symptoms when there's anxiety or depression. So you want to have a healthy eating plan. You know, your eating plan is so important to so many aspects of your life. Fruits and vegetables, whole grains, legumes, beans, peas, and lentils, and lean protein sources. Also, you're including here nuts and seeds. You want to have a physical activity program. Your child should be involved in at least 60 minutes of physical activity each day. You know, go outside and shoot some ball or throw a football. Do some activities with your child. Help your child to get moving and not locked up in his or her room all day long, feeling depressed with the curtains pulled down. You also want to get the recommended amount of sleep. And I know I said that children with anxiety and depression tend to sleep a whole lot more or a whole less more. So you want to try to help that child to get to the point where he or she is receiving or is getting the recommended amount of sleep each night. And then I want you to think about participating in mindfulness and relaxation techniques. You know, take the time to breathe. Take the time to think about positive things. Take the time to infuse your mind with positive affirmations so that you and your child, you can do this activity together. You and your child can be experiencing the kind of normalcy that will make the child happy and successful in life. How do you prevent anxiety and depression? You know, really, it's not known why children develop anxiety and depression, but there are many factors that play a role, and we can look into them briefly. Those factors include biology and temperament, but it is also known that some children are more likely to develop anxiety or depression when they are exposed to trauma and stress, and when they are maltreated or mistreated, and when they are bullied or rejected by other children, when their own parents have anxiety and depression. So those are the consideration, the factors that you need to consider when you are taking care of your child and you're trying to determine where your child is in this in terms of depression and anxiety. You know, these factors may increase the risk of anxiety, but there are ways to decrease the chances that your child will experience them. So you want to learn as much as possible so that you can help your child. Isn't that the theme that we have been repeating over and over? Be knowledgeable so that you can take care of your child. And there are places that you can go also to get help. There's a suicide prevention organization. You can go to bullying prevention. There's a child maltreatment prevention, youth violence prevention, depression after birth, caring for children in a disaster, and adolescence and school mental health. I think I've given you a mouthful today in terms of depression and anxiety. You know, this particular situation or condition that your child may experience, I mean, it certainly will not be a pleasant experience. But the thing about it is that if you sit back and do nothing, you are not empowering your child. And our talk today and our talks every time we meet. It's about empowering, in educating yourself, being knowledgeable so that you can empower your child. And I want you also to remember, taking care of yourself is very important to being available to empowering your child and empowering your community. So I urge you to take care of yourself while you take care of baby, and have a fantastic Friday. Thank you for joining me, and we'll see you again tomorrow for Read Time with Baby.